Our next topic is about Medicaid. Medicaid was policies that were issued that was associated with federal and state entitlement program created by the Title and the Social Security Act of 1965 that pays for medical assistance for certain individuals and families with low incomes and resources. Missouri's Medicaid program is called Mo Health Net. Currently, Mo Health Net covers qualified medical expenses for individuals who meet the requirements. So let's talk about who does it help? Who does Medicaid help? So in all states, Medicaid provides health coverage for some low-income people, families and children, pregnant women, the elderly, people with disabilities. In some states, the program covers all low-income adults below a certain level as well. Missouri currently, which I'll touch a little bit better, does not. They're in the process of covering the low-income adults currently. So if we're looking at the pregnant women and newborns, this program provides health coverage for up to 60 days after postpartum for pregnant women. And once the newborn is delivered, it will be switched to Kids Mo Health Net. And then families, which Missouri is in the process of covering more than just the children and uninsured women, people with disabilities. So these are people who are permanently and totally disabled, and they have to be defined by the Social Security Administration to get that coverage. Kids, these are under the age of 19, whose family income falls within those certain guidelines as well. Uninsured women, so coverage for Medicaid for these women are methods of contraceptive, sexually transmitted disease testing and treatment, including Pap tests and pelvic exams. It also includes family planning, counseling, and education on various methods of birth control. Just like the disabilities with blind and visually impaired, they need to provide medical care for these guys, and they also cannot have a spouse who can provide that support for them in order to be included in this. So in the state of Missouri, Mo Health Net does provide a HIPP program. So HIPP stands for Health Insurance Premium Payment. Many people don't know that this program exists. A lot of times they sneak in this form when you get your paperwork for Mo Health Net that you're filling out, and they ask you to fill this out to see if you qualify. So what the HIPP program does, it calculates, so you send in information about what your premium is. You send in all your information about your health insurance that you can get through your employment. And then you also write down a list of who's all included in your dependents. So you include yourself, all the children, and a spouse. They have a way or an algorithm to see if it is in their advantage to pay your medical premiums that come out of your paycheck in order to keep the Mo Health Net participants on both insurances. So it would be a primary insurance of what you're carrying through your employment, and then whatever your primary insurance does not pick up, Mo Health Net picks up at that point. Here I've got a graph that's got some shaded states as well as these blue and the red. The shaded states are those that were currently trying to adopt Medicaid expansion. Ours, the state of Missouri, should start this summer. And what that will do is, because of the Affordable Care Act, it has given Medicaid a bigger branch of more, so way more people can be covered. Missouri was one of the 13 states that originally rejected the Medicaid expansion. The state must submit or create an amendment plan. If you are looking for more information about Medicaid, I have provided a link for Medicaid below. I also provided a link for more information about that HIPP program as well for individuals. Next, we're going to talk about Medicare. Medicare and Medicaid kind of relate together as well. The difference is Medicare is our health insurance for our people that are 65 and older. Certain people younger than the age of 65 can qualify for Medicare, including those with disabilities or have permanent kidney failure. Most people age 65 and older are eligible for the medical hospital insurance, which I will talk about more on the next slide. I will break down each part of that. Initial enrollment for Medicare is 3 months before your 65th birthday. It includes the month you turn 65 and ends 3 months after that birthday as well. If you choose not to enroll and decide to do so later, your coverage may delay and you may have to pay a higher premium as well for that. So Medicare has 4 parts. Part A is the hospital insurance. So this helps pay for inpatient care in a hospital or limited time at a skilled nursing facility. Part A also pays for some health care and hospice care. Medicare Part B pays for services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventative services. Part B covers certain doctor services, outpatient care, and medical supplies. Then they have Part C, which was known as Part C before, but now it's called Medicare Advantage Plan. It includes both Part A and B. Prescription drugs and additional benefits such as vision, hearing, and dental are bundled together in this plan as well. With the Medicare Advantage Plan, you get a separate card for each service that you have. You'll also need to use healthcare providers to participate in this network plan and service area for the lowest costs. These plans have a set limit on how much you'll have to pay out of pocket each year for covered services. There are types for that Part C as well. You can have the HMO plans, the PPO plans, the private fee for service, and the special needs plans as well with that advantage. Part D it just helps cover the cost of prescription drugs. Medicare Part D, it also helps with a lot of recommended shots and vaccines as well. There is this gray area as well for Medicare patients as well, that sometimes they need Medigap. So Medigap is a supplemental insurance that some individuals have. It can help pay out-of-pocket co-payments, co-insurance, and deductible expenses as well. If you're looking for more information on Medicare or want to dive in a little deeper to the material, I did provide a link that I did find most of my information from as well.